here live at County Hospital, Ogba, to speak with the medical director of the hospital and some of the staff, the nurse or the matron, on the effects, prevention of cesarean operation in Nigeria and the increased rate at which most women now prefer to give birth through cesarean operation.
So we'll start by saying that cesarean operation, popularly called CS, is an interventional procedure. What that means is that you do it you are intervening. Ideally, delivery should be by through the vagina. For some reasons, if the man cannot deliver through the vagina, we'll do an emergency, we'll take the delivery through CS. So cesarean section can be either, there are causes of cesarean section. We call them indications for cesarean section. The indications are divided into maternal indications and fetal indication. Maternal indication means those indications, the reason for the CS is that it's from the mother. Another reason for the CS is if the reason you are doing the CS is for the baby. For instance, a woman who has a small pelvis. Pelvis is the waist bone, whereby you have calculated that with the way this pelvis looks, the baby cannot pass through. You know that the person will have to do a cesarean section. Or the baby is big, not like the pelvis is not adequate, but the size of the baby, say greater than 4 kg for instance, you are trying to avoid consequences that can occur. You do CS for the person. Or you look at the placenta. Placenta is what the baby feeds from through the mother. If the placenta suddenly pulls out, so the baby will be compromised of oxygen and nutrients. So you want to do CS to bring out the baby. Or the placenta has not pulled out but is located down towards the cervix, such that if baby is coming and labor starts, placenta will come out before baby. For such, you don't want to risk, you want to do cesarean section for a woman. So I just mentioned a few maternal indications. Or the woman has high blood pressure, a condition we call preeclampsia. You want to bring out that baby on emergency. Or the woman has even not just having preeclampsia, she's not convulsing. That's what we call eclampsia. You want to bring out that baby fast. A woman who has had 2 CS before cannot go through a normal delivery in the third delivery. In the third birth will not go through a normal delivery. Reason being that if you have cut a part of the body before, once labor starts and is contracting, it can tear from that place, you know. So those are the indications, maternal indications. Another one I said is the fetal indication. That is looking at the baby for the reason to do operation. If the baby, one, like I mentioned, is looking too big, you know, I don't want to take the risk, you can do that. If the baby is having fetal distress means that the baby is already, the head of the baby is getting compromised. You want to quickly bring out the baby. Some women again say, see, I'm not ready to go through the pains of CS or normal delivery, rather, I will do an elective CS. Those are the indications why people do CS. CS is a very safe procedure, especially when done by a well-trained physician in a center where they are well trained and be prepared for it. It's a primary care procedure. So it's safe both for the mother and for the child. The word there is a trained engineer carrying it out. When you are doing CS, it is the womb you cut. So when we say don't cut more than 3 times, is because the more you cut and suture, when we say suture, the more you cut and sew, the less strong that area becomes. You did the first one, it has become less strong. You did the second time, it's not as strong as it was. A third time, a fourth time. Actually, it's not that we don't do CS up to 4. We do CS up to 4 because if the woman comes, she's pregnant, we need to go and abort it because of that. We'll still do it, but to be on the safe side, it's just erring on the side of caution.
Like 60 to 70% of people prefer to go through CS in Nigeria because they feel like, okay, when going through it, you don't feel labor pain, nothing, you don't go through anything, and after when you are done, your pain is being managed. Unlike the SVD, where they go through labor pain, and most times there's nothing to give them when they are going through labor. Like maybe when you are abroad, they give you pain relief just to relieve the pain during labor. But this cesarean section, many people are always anxious, scared to go through it because they will tell some people, okay, you have to do this cesarean section to save your life and your baby's life. They'll feel like, okay, no, I have to call my pastor and all that because they are scared, anxious. Though it's not that we just say, okay, come and do CS. No, there are some medications that warrant you doing cesarean section. We have like preeclampsia, we have big baby, and sometimes, most times too, in this, like let's say in our hospital, yeah, most time patients prefer to do cesarean section. Like that is how we say mother's preference. So the only thing we do is to provide psychological and physical support to the mother so that they won't be scared, they won't be anxious. We let them know that, okay, these are the people that have done this cesarean section before. This is the outcome. Their baby is fine, the mother is fine, and within some days of hospitalization, they leave the hospital.
You just heard from Dr. Azu, the medical director of Canton Hospital, speak on the side effects of cesarean operation, the process, and what it entails, the reason why they prefer to do cesarean operation these days. We also hear from Mrs. Adebisi, who is a midwife at the hospital, also enlightening us about the process, why most women these days prefer to go into cesarean operation than the normal delivery. Edwin Usoboh, reporting from PENRADIO.